This tussle is headed. Vishal Bali, CEO of Fortis Hospitals, joins us live from Kolkata. Vishal, many thanks for joining us. We just heard the comments they're coming in from Breach Candy and Just Look saying that there is no resolution at this point in time, that the reports are factually incorrect. So set the record straight for us. Have you guys decided to play ball with the insurance companies? Have we actually arrived at a resolution, or are we waiting now for that August 30th meeting before we can actually take a call on the way forward?
Shireen, there is, from the provider's point of view, there is no resolution which has been reached as yet. As we have been saying that we are not, more and more it is looking like as if it is just now a problem between the larger hospital groups and the insurance companies. That's not so. What we have been trying to tell to the insurance companies for quite some time now is that we need to create a framework which works for the entire sector. It works for the larger hospitals, for the mid-segment hospitals, and for the smaller hospitals. So we don't really have a conclusion on that as yet, and all these reports that have been coming out through the third-party administrators are factually incorrect, because there is no alignment and there is no resolution which has been signed by the larger hospital groups or even the smaller hospital groups. If you look at it, 450 hospitals in the preferred provider network across the country is a very minuscule number. And I think, we need to really see tens and thousands of hospitals getting into the PPN network if we have to really make something out of the cashless service being reinstated in the hospitals.
Okay, Vishal, you're saying that no resolution has been arrived at least as of now. Several meetings have already taken place. We understand there is another meeting, a crucial one, on the 30th of August. Now, let's talk about one of perhaps the most controversial bones of contention between the insurance companies as well as hospitals. That is the issue of differential billing, a charge that hospitals are refusing to accept. Has there been any forward movement on the charge of differential billing by hospitals?
Shireen, this entire claim that the hospitals charge the insured patients higher than what they charge the regular patient is absolutely incorrect. In fact, hospital after hospitals, and particularly the larger ones, we have all done our internal research. There is no evidence of any kind which basically states that the insured patients are being charged higher than the uninsured patients. Having said that, I think what is very, very important and what we've been really talking to the insurance companies is the need for a new framework. We've been talking about that the hospitals need to be graded. They need to be graded on infrastructure, they need to be graded in terms of the clinical expertise they have, on the clinical outcomes, on the results, on the basic infrastructure of their operating rooms and the technology, and also the kind of manpower that they employ. And based on those gradations, the price points of the procedures in those hospitals need to be fixed. And that is a framework which is a global framework. All over the world, a framework like this exists, and that's what we really require in India. What is really happening right now is the entire conversation is just focusing on one element, and that is the price points. Now, you can't take an arbitrary price point and go to a hospital and say, either you accept it or you're not a part of the preferred provider network. Many of the smaller hospitals do not find, and even the larger ones, do not find these price points viable at all. So I think the conversation fundamentally has to revolve around a framework which is good for the patients, which is good for the insurance companies, which is viable for all the hospitals. Not just for the larger hospitals, but for all the hospitals across the sector.
So, Vishal, what does this really mean for the Indian consumer at this point in time? Because we had Naresh Trayan on, he also heads the CII Healthcare Committee, saying that, exactly the things you're talking about, this gradation system, that different hospitals have different sorts of infrastructure and they cannot all be clubbed under one umbrella. But if there's been no forward movement in being able to even develop or sketch out this framework, then what are we really talking about in terms of a timeline to arrive at some sort of a resolution? The Indian consumer is suffering.
See, we started this conversation almost about a month back, and when we first started the conversation, they had even stopped the emergency cases getting admitted on a cashless basis. I think the insurance companies were able to certain reason with what we had put across on the table in terms of that it is really going to cause a lot of disruption in terms of patient activity, and therefore this needs to be reinstated. The emergency cases and the availability of cashless services for emergency cases was taken back, and therefore now patients getting admitted on an emergency basis are given cashless services. I think now we are getting into the next phase. So we have had a couple of conversations, and the good thing is that the insurance companies are beginning to understand our reason. The insurance companies are beginning to understand that what the sector is talking about is ultimately going to be good for the patients too. Today the patients have no idea in terms of the utilization of their cover. Patients get admitted in hospitals and ask for the most expensive of rooms and the most expensive of treatment because they believe that they have the available cover to spend it, which is not correct. So what we are basically trying to tell the insurance companies is that please create limitations around what people can even spend with the kind of cover that they have around certain procedures. There is nothing wrong in that. So I think the conversations are happening right. We are on the right platform. We are engaging very correctly with the insurance companies. And I think over the next 2 to 3 weeks, we should be able to come up with some resolution here. Amongst the stakeholders, we have had multiple meetings. We are creating a framework which we will present to the insurers and to their third-party administrators. And I see that, probably in a very short period of time, we should be able to come to a conclusion. Right. We want services to be reinstored to patients, and that's what we all want. We want good quality of healthcare to be delivered to the Indian patient.
Very quickly, Vishal, on this issue of differential pricing, as Shirin was just mentioning, Dr. Trehan was on the channel just a couple of weeks ago, and he was mentioning the fact that this issue of differential pricing is a reality. There may be it may be few and far between, but is the industry as a whole doing anything about fixing that problem?
See, Harshad, that is exactly what we want. See, what happens is that, this entire issue of differential pricing. Now, supposing a small nursing home somewhere is charging a differential pricing, you can't make it an industry-wide phenomena, right? You can't go around and tell that all the hospitals across the country are overcharging the insured patients. And the framework that we are talking about actually limits that. When you create a framework around which a procedure is priced, is number one, priced right, and then you provide that price point to the hospital, the patient knows that he will get only that amount of reimbursement. The hospital knows that that's the level of reimbursement that they will get for that particular procedure. The insurer knows that that's the cutoff limit for that particular procedure. And that's exactly what we've been asking them. We are not asking the insurance companies or the third-party administrators that we need to be given higher price points than what exists right now. What we are trying to tell them is create a rationale which works very well for everybody concerned. And it is not just about the price point, but it is about the very logic of how the entire cashless system and the insurance system should work.
All right, Vishal, we'll have to leave it there. Many thanks for joining us. So no resolution, at least up until now, as far as the cashless insurance business is concerned. The hospitals, they're coming out and saying that the reports we've seen in the newspapers are not factually correct. Coming up.